Chair of the Health and Social Care Select Committee, Steve Brown.
Last July, the Health Select Committee, which I chair, published an important report, I think, into NHS dentistry, and I urge colleagues to read it if they haven't already. It's been referred to a few times. I would say that the inquiry was more necessary than ever, and I'd actually argue that the issues our constituents face in accessing an NHS dentist right now is a greater challenge for my colleagues on the front bench than a much higher health promise to cut the waiting list that features in the Prime Minister's 5 pledges, because every member faces this challenge. And the Secretary of State is absolutely right in her amendment to reference the pandemic and the massive impact that's had on dentistry. To ignore that is just to ignore basic facts. Now, our committee concluded that NHS dentistry is facing a crisis of access, and that is now obviously no understatement, and that resulting in a decline in oral health. That report was described by the British Dental Association as and I quote, an instruction manual to save NHS dentistry. And it sets out, based on the evidence, and I stress that word, the evidence, that we received as a cross-party committee on what the government should do to address the crisis. I want to thank the Secretary of State for coming before us just before Christmas and for ensuring that we received a formal response to our report, albeit a few weeks later than I would have liked. The Labour motion that is on the order paper today, Madam Deputy Speaker, I mean, it contains some pretty reasonable parts. I think that is perfectly obvious that there is some people resorting to DIY dentistry. That is a fact. It is a fact that some people are attending A&E as a result of dental challenges. The 700,000 urgent appointments a year that the opposition talk about, I mean, the reason I can't support the amendment is because I hear no detail as to how. I hear no detail particularly as to who these dentists are that are going to fulfil all of these appointments, and I certainly hear no explanation as to when. The recruit new dentists to the areas most in need part, well, yes, but as the Secretary of State referred to in her opening remarks, you know, we're increasing dentistry training places by 40% as part of the NHS long-term workplace plan. The biggest expansion of places on record is important, and I think it should be recognised, as it was at least the government dispatch box earlier on today. Now, going back to our inquiry, during evidence, the then Parliamentary Under-Secretary, my honourable friend who sits for Harborough, described the government's ambition for NHS dentistry as, and I quote, "We do want everyone who needs one to be able to access an NHS dentist." Absolutely. Now, the government welcomed this ambition, but the committee welcomed this ambition, but if I'm honest, we were surprised by it. What I would ask, in the most optimistic reading of the reality on the ground, leads the new ministerial team to believe that is a deliverable. And if, Dave, my first ask of the Minister in her summing up is whether she would repeat that as her predecessor did. Don't get me wrong, Madam Deputy Speaker, I absolutely believe that everyone should be able to access an NHS dentist when they need one, wherever they live. I just question right now, given the reality of where we are, whether that's possible. Now, in our report, we asked the government to set out how they intend to realise that ambition and what the timeline will be for delivery as a matter of urgency. They accepted the recommendation, but the detail, as we have heard, is at the moment still lacking. Now is the time, please. Let me just touch on the dental contract. It's right to recognise that action has been taken. Some initial changes were made to the dental contract in July 2022, and we have had assurances of quite fundamental reform by the then Minister and again by his successor, the new Dental Minister, who's on the Treasury bench. My committee believes a fundamental reform contract must be implemented at the earliest possible stage, and this has to represent a full move away from the current system of units of dental activity, the UDAs, in favour of a weighted capitation-based system, which provides financial incentives for seeing new patients and those with the greatest dental need, in turn prioritising prevention and person-centred care. I think failure to do so risks more dentists stopping NHS work or not starting it, and exacerbating the issues that my constituents are experiencing in accessing care. My dentist recently gave up NHS work, as I've said in the House before. I know that it was a big emotional decision for her to stop doing that. Any reform to the contract now is too late for her. So the opposition and indeed the government, have got to work out how they're going to get people to come back to NHS dentistry and to reform the contract to stop more accessing the exit door. It's not just about contract reform. Workforce reform is greatly important. We didn't get sufficient acknowledgement of the lack of accurate data about the dental workforce in our report. Could ministers please revisit that? There were so many other recommendations. I don't have time to go into them all today, but the report is there available, as is the government's response. The Secretary of State has made a good start, and she said that she's begun laying the foundations of change, and I'm encouraged by that. But as we've heard, there is still no date for the publication of the Dental Recovery Plan. To my committee's continued frustration, it has to be said. If we don't solve this crisis, then we are going to continue to hear about this in the House, and we're going to continue to hear about it from constituents. It also places additional pressures on already stretched NHS services. So to do it, today is too late for some dentists thinking of leaving, and for some patients who've run out of options. We need a short-term set of actions to help our constituents suffering real pain today, and obviously we need that fully reformed dental recovery plan hot on its heels. There can't be any further delay. Thank you.